So we'll start out with the case. This is an 11-year-old female with recurrent patellar instability who had an initial traumatic event and has had several since then. The patient had prior underwent MPFL repair at an outside hospital, so it had a soft tissue procedure performed before, but continues to have patellar instability and subluxations. So the question I think it's important for all of us to ask is, why did this surgical reconstruction fail? A lot of times patients will undergo a soft tissue procedure and will come back in with recurrent instability, and it may not necessarily be due to a traumatic event. They may have felt like their patella was subluxing after the soft tissue procedure, or they may have felt a subjective feeling of instability, even though there may not be frank instability actually in the office. So I think it's important to look at what are the failures for the repeat dislocation or the failure of the surgery. So the first thing is that number one, you want to look at tunnel placement. And if the tunnel is wrong from an MPFL type surgery, you want to do a revision if the tunnels have not been in the appropriate place. Number two, you want to look to see if there's any genuvalgum, and this patient is skeletally immature, so an option would be guided growth, and we'll talk about that. If they have patella alta, you can do a tubercle distalization, which I'll talk a little bit on in my following talk. As Brian mentioned, if they have an increased TTTG, then you want to medialize the tubercle. If they have patellar tilt, as Mahir mentioned, you want to do a lateral release. If they have trochlear dysplasia, you may want to consider a trochleoplasty, although it is a little bit more complex and not many of us do it. That is an option.